Hi guys, welcome back to our podcast, his podcast, Face the Facts. I'm Tam. I'll be taking over today, and this is Eleanor, right? And then here we have Dr. Brandyn Dunn.
Hi everyone, Dr. Brandyn Dunn, facial plastic surgeon here in Newport Beach, California. We have a special guest. Actually, we have two special guests. We've got Tam and Eleanor, Miss Eleanor, and we're going to be talking about frequently asked questions, right?
Yes. So the top three hot topics, top three most asked questions is it going to hurt? When can I get back to my normal activities? And what was the other one? Oh, we're just doing one at a time.
Yeah.
Oh, okay.
Yeah.
I thought I was naming all of them.
No, we're just having a question.
Oh,
No,
okay.
we're just chatting.
Yeah, this comes natural. Okay. Okay, so hot topics. The first one we're covering is,
What is it?
does it hurt?
Does it hurt? Does what hurt?
You tell me.
Okay. That's a good question. Facial plastic surgery, it's obviously the real deal. It depends on the type of the procedure. We do simple procedures in the office and we do really complex procedures in the operating room, facelifts, neck lifts, all those types of things. So there's a varying degree of pain. There's some amount of discomfort. If you go into these topics or you go into these procedures and expect no pain at all, you're going to be disappointed. So I think that some amount of discomfort and some amount of pain is very normal and to be expected throughout the process. So, I think we do a lot of things in our office well to be able to kind of help support you through that process. We try to educate you in what to expect during the procedure. We provide pain medication to help you throughout the process. We help to give you tools and coping, mechanisms to kind of help you when that pain comes up. But I think the real thing is there's going to be some discomfort. It's probably going to last the first couple of days or so, but afterwards, most people don't have a lot of pain with facial plastic surgery. And I will say that if you have a lot of pain, then that honestly, that can mean that something else is going on, like an infection or a hematoma or something else. So yeah, pain is kind of an indication, very normal in the beginning and concerning as time goes on. What other questions?
Fantastic answer.
Thanks.
Next question is, when can I get back to my normal activities?
So it depends on what your normal activities are. And I would say, for most people, I will say social downtime, depending on the procedure. Let's talk about kind of our most popular procedures. So face and neck lifts and then liposuction. So liposuction is probably about 7 days or so, 5 to 7 days of social downtime. And I'll say for face and neck lifts, it's probably closer to the 2 to 3 week mark. So it does depend on how comfortable you feel kind of in your own skin. You're not going to be fully healed. You're not going to be fully back to all of your normal activities, but really you're going to start to feel more comfortable getting out and about doing things at around the 2 to 3 week mark. As far as getting back to all your physical activities, I say 4 to 6 weeks for pretty much all procedures. Between the 1 to 2 weeks and 4 to 6 weeks, you're really getting back and increasing your activity level. Yeah. What do you think?
Yeah, no, I think that sounds pretty on point.
Yeah.
What do you think, Eleanor? Okay, last question here is, will I need help?
Yeah, I think that's actually such an important topic to discuss because I think a lot of people that come in are young, they're healthy, they feel good, they take care of themselves, they're financially comfortable. They either, have family members that they live with or they live on their own or whatever it may be. But a lot of people are like, I can do this by myself. And honestly, you can't. I gotta be honest. These are real procedures. These are not like getting your hair done. This is not like getting your nails done. This is not like, a quick, easy, non-surgical treatment. You really are going to be recovering after this. And you need someone that you can lean into during that process. I mean, you talk about it with patients all the time during our post-op stuff, right? And when you're talking about consent and consultations and all of that, we talk about needing aftercare facilities or needing nurses or having loved ones or friends or someone that you can lean into a little bit because it doesn't, you're going to feel vulnerable. You're going to feel really uncomfortable the first couple of days. And then you're going to get better. You're going to feel great and you'll be able to take care of yourself. But the first few days, I typically say, honestly, the first week, it's best to have someone around that you can lean into, ask you to get to, a cup of water, ask you to get you some food, just even help you up to the bathroom or to a shower or whatever it may be. It's challenging. What do you think?
Agreed.
Yeah. Definitely
have help.
Yeah, right. I mean, I think it's super important. You see patients that come in on their first day. When we see people back their first day, it's sometimes it's really hard for them, right? Yeah. I mean, not everyone. Some people do really, really well, but I think that's more the exception, honestly, than the rule. So, I think getting help afterwards is really important. We have a lot of tools and supports to be able to kind of make sure that we can set you up if you're looking for someone to help you throughout the process. But yeah, it's vital to, honestly, if you want the best result, you need help during the first week or so. You really do. So, yeah.
All right.
Food for thought.
Noted.
You want to wrap it up?
Yeah. So again, thank you for your fantastic answers and thank you guys for tuning in. Check in next week for more on this podcast. Well, thank you guys for tuning in. Leave us any other burning questions in the comments and then, we'll get around to answering all of those next time.
Okay. See you guys soon.